Yeah, I think for patients out there listening is when you're in a lot of pain, you're usually in a spasm. So
Mm,
you'll have muscles that are just guarding, they're holding on really tight, they're not happy. The body's telling them, hey, something's hurt here, so don't move it. And that's usually when you're pretty miserable. If you've ever done that to your back, that's the day you can't get out of bed. It's like I
mm,
can't stand up straight. It's just my back went out. That would be an example of that. So there was a nurse actually that I was working with at a day we were doing an installation at a clinic. I believe it was in Alabama, and I was asked to help treat her knee. She had a total knee, and we were doing that to see if it would help her bend it better and feel better, which we did. And it actually did move better after the treatment. And she was like, "Hey, that's pretty cool." She's like, "But does this work on backs?" And I was like, "Well, yeah." I said, "It can." I was like, "Why? What's going on?" She goes, "Well, I had a fusion in my back, 6, 8 months ago." And she goes, "It's been sore, ever since. It's never felt, better, And so I was like, well, maybe. I said, there's a lot that could be going on there, but let's take a look. So I said, let me see you arch backwards. So she went to arch back and she was standing, it's a small treatment room. She was next to a wall. And she probably had about 10 to 15% of her extension motion and then just sort of stopped.
mhm.
And I wasn't sure if that was something that was related to the fusion or what, but poking around her back, you could tell there was some guarding going on there. So just for the edification of the audience, like when you have a pain, sometimes a deep pain, like in a fusion situation where you get pain from bones or nerves or things that are deeper, often the guys that move you are more superficial. So in your back, you have this erector spinae group that goes right along the sides of your spine. And when your back's not happy, they tend to go into a spasm. And that's what this lady had going on.
Hmm.
So even though she had a fusion in her spine, I treated her muscles of her lower back for about 4 or 5 minutes. And then I retested the extension. And she basically stood up and she went to arch back in the same spot she was standing and she hit her head against the wall because she picked up like another 30, 40% of motion and she couldn't believe it. She's like, holy cow. She's like, I haven't been able to arch back in 4 months. And it was just that analgesic impact we were talking about. It
Yeah.
quieted down the spasm of those lower back muscles that allowed her to do that. So luckily she didn't put a hole in the wall or anything. So that was
Yeah.
that was good.
But